Okay, you're live.
Alrighty, so we're back. Dr. Emer's office in West Hollywood. We're in the middle of a custom facial with Eternity, and I'm just removing her enzyme mask. So she's had this on for about 10 minutes under steam. The steam has kind of amplified the progress of the enzymes, so it kind of put them into high gear and made them activate faster and perform a little bit more strong than they would without the steam. So I'm just removing it, and I'm going to do a pass with the dermal infusion, and then I'm going to do any necessary extractions on her. Skin already looks more fresh just from that enzyme.
So, how did it feel?
It felt really good. You can definitely feel the enzymes working, but it feels very refreshing and soothing at the same time. Yeah.
Awesome.
So I'm going to be using the pore clarifying solution with the dermal infusion. And we have a variety of different solutions that we can choose from. We have a super hydrating one, we have a brightening one, we have a vitamin C, and then we have the pore clarifying. And the main ingredient in the pore clarifying is going to be salicylic acid. Salicylic acid is known for its anti-inflammatory benefits. So it's great for anyone that has inflammation. As you can see, she has some of that associated with her cystic acne. So that's going to really help to calm that down and to combat some of that congestion in the pores. So I'm just going to start right now with a gentle pass over her skin. This is pulling out impurities. You can kind of get a suction sound as I lift off. So it's pulling up impurities, dead skin cells, and it's also pushing in the ingredients in this solution. So this is a super deep pore cleansing treatment. So we're physically exfoliating with the device, and we are also chemically exfoliating with the use of salicylic acid.
Is salicylic acid the only ingredient within this?
No, that's just the main ingredient. This has a combination of different botanicals that are calming. So this really reduces inflammation, helps tighten up the pores and pull out impurities. So there's a number of active botanicals as well. So you can see her skin gets a little pink with the suction from the device, which is totally normal and actually really good. It just increases her circulation and also aids in cellular turnover, which spikes collagen production and lymphatic drainage. So this is full of a lot of different benefits.
How often can you do this treatment?
You can do this treatment weekly. For someone that has an actual issue with their skin that they're trying to correct, I would say weekly treatments would be great. You can even do it as often as twice weekly. We use a gentle enough setting if you're coming in that often so that you're getting the benefit of this without any irritation, because you are doing the treatments more regularly, and that's the best way to see a result. So doing them on a regular basis, spaced not too far apart.
And can you do this as a combination treatment?
Absolutely. We're doing this today as a combination treatment. So I've already used an enzyme peel on her with steam. I'm now doing the dermal infusion. I'm going to do a few extractions on her, and then I'm going to dermaplane her skin. And then I'm going to put a hydro jelly mask on her that is electrolyte infused. So this is definitely a combination treatment. We're combining a lot of different elements into this treatment to achieve the result.
But you can also do it by itself.
You can do the dermal infusion by itself, for sure. You can come in for any of those those different treatments and just do them standalone also. So you can come in and just do the dermal infusion, you can just get a hydrogel mask, you can just get dermaplaning. Any of those is fine. With steam and enzyme mask, that's part of a facial, that's not an add-on. How does it feel?
It doesn't feel bad. It feels, I mean, a lot of people I've heard have likened this to like a cat's tongue, like on your face.
I know that a lot.
So spot on.
Yeah, it's a little bit rough if you guys can see. This little round sphere in the middle is actually a crushed diamond tip. So this is a little rough pad in the middle that is a crushed black diamond, and what it does is it gently exfoliates the skin, and around it there's space for the fluid to come in contact with the skin. So that's the little cat tongue part that she's feeling, is that little diamond tip.
It instantly feels like your face feels cleaner.
Yeah, it is. It's a deep cleaning, kind of like a little wet vacuum cleaning all over your skin. Go all the way up to the orbital bone, just under the eye. A lot of times people get a lot of congestion of pores, the forehead, the inner cheeks, and the chin. That's your T-zone, and that's just an area where most people do have an overproduction of oil. So I really tend to focus on those areas with people that are experiencing some breakout or acne.
And if you're doing dermal infusion just by itself, what is the after treatment like?
The after treatment,
Yeah.
you just don't want to exfoliate at home the same day. So I always tell people, go home and do your regular skincare regimen. Just eliminate the exfoliation that day, because this is your exfoliation for the day. You don't want to over exfoliate your skin, so there's really no need to do it again at home the same day. You can resume that the following day. So that's a good even pass with the dermal infusion. I'm going to shut off the machine now, and I'm going to do a few manual extractions. I'm just going to cover your eyes because the light is a little bright.
Thank you.
Okay. So I love doing extractions. I know it's not the most comfortable part of the treatment, but it's definitely a necessary part. I'm just going to cover her eyes. Alrighty. So I like to use my fingers only for extractions. Some people prefer to use tools. I just feel like there's less trauma to the skin if you're just using your fingers. I feel like when you prep the skin properly with steam and enzymes and salicylic acid, there's really no need to use tools. You can a lot out of the skin with just a little bit of pressure using your fingers.
Why should extractions be done just by your skincare professionals?
Extraction should be done by a professional because if you're trying to perform extractions at home, your prep work is usually not happening. You're not steaming your skin, you're not applying a product that's a professional grade product like we did with the enzyme. And the prep is so important. It just softens your skin and allows whatever is in your pores to be eliminated without causing trauma to the surrounding area, like I said. So that's very important. Another reason that you shouldn't do extractions on yourself at home is when you are extracting something out of the pores, that's usually bacteria, and the bacteria is going to seep into the skin surrounding it and cause you to break out in those areas too. So it's really important to have a professional do your extractions because they can properly prep your skin, and then they can do the proper antibacterial actions afterwards to eliminate any breakout that could occur from the area around the blemish being contaminated. So I'm just gonna go in and gently squeeze some different areas. Now her acne is very hormone related, so some of these are gonna be painful, and I'm not gonna put a lot of pressure on the ones that are in pain. So tell me if anything is too uncomfortable. Are you guys able to see on the camera? Can you see that?
Mm-hmm.
So a little bit of blood coming out at the end is totally fine. That means I've extracted everything that was in that pore. And then blood comes out, and that just means there's nothing else in that pore to be extracted. That's another reason why you shouldn't extract at home, is sometimes you'll halfway extract something and you'll think you got a lot out, but there can still be a little bit left in that pore, and it actually can't close up and be a healthy, cleaned out pore if there's residue still remaining in it. So just another thing to keep in mind when you're doing your own extractions. A lot of times you don't even see a lot of the congestion in the pores until you stretch the skin. So this area looked completely smooth and fine until I stretched it out, and then you could see under the skin there was some congestion. So you doing okay?
Yeah. Thank you for checking in.
Yeah. Here, I'll give her cheek a break and go to the nose. Can you see that?
Mm-hmm.
You're doing so good.
Thank you so much.
And this is what happens when you wait too long. You can't wait this long between your facials.
Seriously.
You need to get them more often, and then it's just less, you know, it's less uncomfortable as well, you know, because there's not quite as much buildup.
No, and then like my cystic, it's like a...
I know.
Is there anything our viewers at home can do to avoid getting so mad?
Just proper home care is so important and regular professional treatment. So coming in on a regular basis to get a really great detox like this treatment, and having a professional peel applied, and then also doing your skincare at home, and have a professional set up your home care regimen for you. Because a lot of times there's ingredients out there that you might not even know that you need to be using that will greatly help your skin. So this one opened up while I was doing the dermal infusion, so we're just going to leave it alone. That's what little blackheads like to hide down here. So think of how much better her products can perform when they're not blocked by all of this congestion in the pores. They can actually sink in to healthy, clean pores and do their job and go to work. All those ingredients can just perform so much better if they're not being blocked by all of this congestion.
Shakaina, why extract by hand instead of using the comedone extractor?
So I don't like to use a comedone extractor because I feel like it damages the tissue around the blemish. I feel like it's not necessary. If you have a good technique already, then it just takes practice. I used to feel like I couldn't do extractions without an extractor. And then I worked at a place that actually didn't allow extractors, and that was like so scary for me at first, but it was actually a blessing in the end because I learned how to do them by hand, and I prefer to do them by hand. I just see that the skin is less traumatized from it. So you don't see little marks afterwards that are left by extractors. Sometimes with sensitive skin, the indentation from the extractor actually lasts for quite some time, and that's not something that you want. You don't want to leave here with little marks all over your face. You want to have less.
Oh wow,
Less
that's
skin.
interesting.
Yeah.
That happened to me during my last facial.
Did
I had
it?
extractions, and I did have like, you know, the little indentations for a few days after, and
See, a few
I was
days.
fine, but it did take a couple days to recover from it.
I don't like that. And as you can see, if you guys are able, if it's close enough, you can see I'm getting so much out just with my fingers. And it's about manipulating the skin too. So I'll switch back and forth between my pointer fingers and my thumbs. I also don't like skin scrubbers or scrapers, those sonic tools that people really push against the skin and drag to pull out congestion. It just pulls out maybe a small portion of it, but it doesn't really purge the skin and the pore and deep clean the pore. Plus it causes trauma because you're really digging into the skin with it, which isn't necessary.
So for someone like me with cystic acne, these extractions like really help your your products to penetrate deeper and help you cure that cystic?
Well, extractions are just important for cleaning out your skin because, you know, with cystic acne, you have an overgrowth of bacteria.
Right.
And so eliminating that, of course, is going to help your skin regain a healthy state a lot faster than if it's just left there on your face. You definitely want to do extractions. You just want to be gentle also and not cause unnecessary trauma. Like for ones like this that are all already so inflamed,
Right.
I'm not even gonna mess with it. Like this actually needs a lot of calming ingredients on it. It doesn't need further you know, trauma. It's very inflamed already. So that might be one that you would go to first just because you want it to go away. You want to get rid of it because it's so visible.
And it needs to just calm.
It needs to calm down because you're actually going to make it be visible for longer if you irritate it further. Sorry.
How does it feel, Eternity?
It doesn't feel that bad. It's just like a little bit of pressure, but it's nothing like, you know, it's not too painful.
Thank you.
It's just a little bit of pressure.
This isn't the most relaxing part of the treatment, but it is one of the most important parts. And the relaxing part comes afterwards. You're gonna get a hydro jelly mask. That's gonna feel so good.
Yes.
Alright, Shaka, now we're gonna tune in with you back in a few minutes when you're ready for the next part.
Sounds good.